Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. In this episode, we talk about the Assam floods, how they are impacting the region this year, and despite the destruction that they cause, how they are also beneficial to the state. We will also talk about who the poet Varavara Rao is and the reason he has been in the news lately. But first, we talk about Delhi. In the last 3 weeks, Delhi has seen a remarkable turnaround when it comes to its COVID-19 situation. For example, in the last 20 days, the number of people recovering from COVID-19 in the capital has remained higher than newly detected infections. This is particularly noteworthy considering the fact that Delhi has been one of the worst affected cities in the country and had been facing harsh criticism for its handling of the pandemic till last month. So, what changed? In this segment, we talk to Astha Saxena, who reports on health for the Indian Express, about Delhi's recovery. Astha, Delhi's COVID-19 situation seems to be considerably improving. And, in the past 2 weeks, it appears to have turned a corner. Could you give us a snapshot of how exactly Delhi is faring right now and to what extent things have recovered?
So on Monday, Delhi recorded lowest COVID-19 cases since June 1. And the case fatality rate was also recorded at 2.96%. So the number of cases reported on Monday were just 954. Delhi has been reporting cases around 4,000 in June. So this was the first time in weeks that the daily tally dipped below 1,000. So this is a very, very heartening situation in Delhi because the number of cases along with the mortality rate has gone down significantly. So when we talk about the dip in any trend for COVID-19 cases, we look at three things. One is the reduction in the number of cases, the daily cases. Secondly, the number of deaths that are being reported. And third, the positivity rate. Right now for Delhi, these three things are going down for like more than 2-3 weeks now. So the peak was recorded on June 23rd with 3,900 cases. And since then, we are witnessing a downward trend. So even the experts feel that, the peak has passed in Delhi and now we are in the plateau phase, that the numbers are going down. And if this continues for more than 2-3 weeks, then maybe we will be out of it. Maybe we will be in a very comfortable situation.
Okay, so what do we know about why this happened? Because Delhi had been faring pretty poorly. Like until last month, cases were soaring. People had been struggling to find a bed. Delhi's testing policies were being criticized. Delhi was accused of not effectively utilizing the lockdown period. The Supreme Court, you would recall, had called Delhi's handling horrendous and pathetic. So, what has changed? Is it something that the government did, or are we just seeing the sort of the end of a storm with the damage already done?
So actually, I would call it a combined effort. So, when you look at a virus or its strain, it has a time period, okay? So it functions according to its own nature. So when Delhi was at its peak and, even the Delhi government started saying that their projection was that by the end of July, there will be around 5 lakh cases and the number of beds will also shot up because they were looking at the doubling rate. The doubling rate at that time in Delhi was around 13%, 13 days. So by that projection, we needed many beds, more ICUs, more ventilators. So when we were in that phase, the MHA also stepped in. A core committee was formed, which was led by, Niti Aayog member Dr. V.K. Paul, AIMS director Dr. Randeep Guleria, whose country's top pulmonologist. He was also a part of that committee. So they visited the hospitals. They, actually understood what is required. So facilities was also ramped up because the center plus state. So that's why I'm calling it a combined effort because both of them work together. Both of them looked after the infrastructure. We started many COVID care centers and new healthcare centers were formed. The testing rates in Delhi, the treatment charges in Delhi were capped. So it became easier for the patients to now reach to a hospital because there were more beds. The treatment cost was easy and they can afford it. This is one part. Secondly, when we look at the virus, if there were 4,000 cases at the time of June, so the incubation period is around 28 days. So those people have started recovering now. So that peak has gone and the recovery is also going up. So everything is happening simultaneously. And Delhi has been doing good in terms of home isolation, which has been appreciated by many other states, and now UP is also following it. So it is one of the techniques that actually help Delhi in, taking the disease to next level, to actually provide more treatment to the people and without overwhelming its hospitals.
This is great, but could it be that this bright picture that we're seeing, there's a possibility that we are seeing it because there might have been change in testing, that maybe because we aren't testing enough, that's why we're seeing these low numbers?
So in Delhi, we are using three techniques right now for COVID testing. So one is RT-PCR, which is the gold standard for testing. Second is the antigen testing, which is basically used in the containment zones where we get the results in 15 to 20 minutes. And third is antibody testing, through which we check the prevalence of the disease. So these three testing are going on, and the central government told Delhi to actually increase the testing. So at a time, we were also told that we have to test 20,000 people in a day, which is a huge number. So as we increase the testing, of course, the positivity rate also increased. More people started coming forward, and even in the containment zone, the aggressive action was taken up after the ministry stepped in. So that is one point. Secondly, for a virus also, and now for Delhi, it's important we can't let our guards down saying that okay, now we are done with the virus and we can move out freely. We still have to look at the numbers, because there are many patients, even experts are saying there might be many people which are asymptomatic and they have not been tested. So there are chances that many of them will come, maybe a month after we feel that the peak is over. So we have to still follow and monitor the situation. It is possible that many cases are still at their homes and we still don't know that they are positive, but since they are asymptomatic and they don't have any symptoms and they're not getting themselves tested.
And now with the number of active cases coming down, in what way it has eased up the burden that Delhi's healthcare system was facing?
Actually, Delhi's healthcare system was initially overburdened, and we were scared that how are we going to manage the situation, because even before this pandemic came, entire health system is always overwhelmed. We are always running short of healthcare staff. We don't have enough beds. We don't have enough ventilators. We don't have enough ICUs. So all these factors were always there. But since this pandemic came, all the governments, all the officials pushed Delhi to have more number of ICU beds, to have more ventilators. So now we prepared an infrastructure to deal with 5 lakh cases, which 80,000 would require hospitalization. So at present, we have space, we have COVID care centers which are lying vacant. Even if we look at the hospital beds, so till Monday evening, we have over 15,000 COVID beds in government and private hospitals, and around 11,000 are lying vacant. And we have around 1,178 ICU beds with ventilators, out of which 456 are occupied. So the situation right now looks a bit calmer, that we have space for the patients. Also, one very important procedure that we followed was that the mild patients were suggested for home isolation and severe patients were shifted to the hospital. So when we divert these patients to these two centers, the hospitals are also not overburdened, because they have to look and provide care to only those who needed it. So because mild patients can be treated at home, with if we provide them a pulse oximeter and these district officials are visiting them for continuous monitoring. So that is going one side. That's a parallel program that we are running. So these two things are going together. And right now we feel that, okay, we have enough space for the patients right now. I met the Delhi Health Minister Satyendra Jain yesterday. So he was telling me that even if the number of cases will go up, Delhi is prepared to set up 30,000 beds. Right now, we have set up 15,000 beds, but the second plan was to set up 30,000 beds if the cases increase.
And you mentioned that experts are saying that the peak seems to be have been over, and things will only get better, I suppose, from here. Where exactly do experts say the situation to be headed as far as Delhi is concerned?
So if the downward trend continues for another 2 weeks, then the dip will almost be there for 4 weeks, right? So if this same trend continues for 3 more weeks, 3 to 4 more weeks, and we have to look at 3 parameters that I also mentioned before: the number of positive cases, the number of deaths, and the positivity rate. If these 3 things are going down parallelly on the same time, then we will say that, okay, we are out of the virus, but we cannot say that we have to not follow the social distancing rule and wearing mask and all the surveillance that is being done. because the experts have been saying it is going to be there, but like malaria and dengue, this virus will also be in the air for years, and it will become a routine affair. So we have to take enough preventive measures that we take for any other viruses. Like for dengue, we spray our houses, we do not let water collect at the places, and we take enough medicines. So once the vaccine is out, it will be more comfortable situation for the entire country, but we can't stop taking preventive measures. So we have to inculcate these habits in our routine affairs. And AIMS has also begun the process of recruiting volunteers for conducting this human trials for co-vaccine. So maybe in the next few months, the process will be completed, and we might be close to having phase 1 of the clinical trial of this vaccine. And if everything goes well, by the next 6 months, we might have second phase of the trial, which will go on to the third phase.
Before we get to the next segment, I just wanted your quick attention. One of the big reasons people say they like this show is because it helps them understand the news better. It provides them with the context they need to see the bigger picture. And there is perhaps no other place that does that better than Indian Express's Explained section. We on Three Things refer to the section regularly, and it helps us make this show. If you're a regular reader of Indian Express, you know how useful the Explained section can be, especially when you're looking for in-depth analysis by the right experts. You can log on to indianexpress.com/explained and access the coverage 24/7. Explained by Indian Express, where news that matters is explained by experts who know the subject. Now, back to the show. Next, we talk about Assam. The annual floods in Assam have once again wreaked havoc in the state. So far, at least 110 people have died due to floods and landslides this year, and the Assam State Disaster Management Authority has said that over 25 lakh people have been affected by it. In this segment, we talk to Abhishek Saha, who reports on Assam for the newspaper, about how the state has been dealing with the floods this year.
Every year, floods happen in Assam, causing a lot of damage, loss of life, property, animals. But this time, the COVID pandemic has added a new challenge for the administration to manage both the things together. Even in the flood relief camps, where people from the submerged areas are brought to stay, even in the flood relief camps, this time the government has issued new guidelines which basically take care of the COVID hygiene and safety protocols.
Safety protocols like maintaining hygiene and physical distancing. But even these basic measures in the time of such crisis in traditionally densely packed relief camps can be hard. And there remains a big question mark as to what extent the COVID-19 guidelines are actually being followed on the ground. But Abhishek says that so far the state seems to have kept up their flood relief efforts while also handling the COVID-19 crisis. But the pandemic has come as a double blow, especially for farmers in the state.
When I was talking to farmers across several districts which have been hit by the floods, what they told me is that the problem is because of the lockdown since March, several supply chain mechanisms for vegetables were not functional at all. And basically, that led to a lot of farmers not being able to sell their products at that point of time. And then the floods this time came at least, say, approximately a month earlier than it was supposed to come. So some sort of an early flooding and a COVID-related lockdown dealt a double blow to the farmers of the state.
Apart from the toll the floods have taken on human life and property, they have also led to the death of a number of wild animals like deer and rhinos in the region. This year, the floods have submerged 85% of the Kaziranga National Park, which is famous for its one-horned rhinos. This year's flooding in the park is said to be the 6th heaviest in its history.
Even last year, the floods were really bad in Kaziranga. And this time also, the flooding has begun, and officials say that till now 100-odd animals have died. And officials say that the animal death toll could increase in the coming weeks.
To prepare for the annual floods, the authorities of the park keep a track of updates from the Central Water Commission and monitor water levels of the Brahmaputra tributaries upstream in Arunachal Pradesh. And over the years, another measure taken by the park has been artificial highlands built inside the park for wild animals to take refuge in during the flood.
So the state government and the officials at the Kaziranga National Park, they say that these highlands, along with the better management of the corridors, the animal corridors through which animals travel to upper reaches, this multi-pronged approach could lessen the problems which the animals face during floods.
There is a lot of visible destruction caused by the floods. But ecologists point out that floodwaters have historically rejuvenated croplands and fertilized soil in the state's alluvial areas. In fact, among experts, there is a consensus that floods are essential for the survival of the Kaziranga National Park. They replenish the park's water bodies, the river's fish stock, maintain its landscape, and also help get rid of unwanted plants such as the water hyacinth.
Because it's a riverine ecosystem and it benefits immensely from the flood. And there are also environmentalists and long-time wildlife observers at Kaziranga who believe that animal deaths, although for us humans it's really painful, but at some level the floods and the associated what we call damage or deaths of animals, these are also part of a larger natural process which plays out in our jungles.
A way of natural selection, many believe, considering old and weak cannot survive the floods. But despite the floods being beneficial to the region, the state governments over the years haven't found ways to contain the toll taken by them annually. And there is a need to mitigate this problem, keeping the long term in mind, especially considering climate change models predict that floods will only become increasingly devastating with each passing year. As of now, the Indian Meteorological Department predicts that the northeastern states, including Assam, are likely to experience widespread rains in the next 3-4 days, which means more flooding in the region. In the end, we talk about a poet and an activist who has recently been in the news, a man named Varavara Rao who has been in jail since 2018. But why is he in the news now? And who exactly is he and why is he in jail? To answer these questions, Sadaf Modak, a reporter from Mumbai who's been following his case, joins us.
Varavara Rao is a Telugu poet and activist. He was born in 1940 and is known to have begun writing poems from a very young age. Throughout his life, he has been known to also participate in a lot of pro-people movements, including the peasant movement and the agitation for separate statehood for Telangana from 1969. More recently, we know him as someone who has been behind bars since 2018, along with 10 others named as accused in the Elgar Parishad case.
So how is this, 70, almost 80 years old poet, activist involved in the Elgar Parishad case? And what did he exactly go to jail for?
So on January 8th, there was an FIR registered in Pune based on a complaint filed by a resident of the city named Tushar Damgode. An event was held in Shanivarwada in December 2017 in Pune. He claimed that that event was the reason why violence took place on January 1 in 2018 in this place called Bhima Koregaon, where a lot of Dalits assemble to commemorate a battle between Peshwas and the British. And the FIR claimed that the event, the Shanivarwada event, was organized or linked to the CPI Maoist group, which is a banned group. And it also claimed that the accused, including Mr. Rao, had participated in organizing the event and were also fronts for the banned Maoist organization.
Okay, so he was arrested in 2018, you mentioned. It has now been a little over 2.5 years since he first got arrested. Why is he in the news right now, and what is the controversy around that?
So when the COVID outbreak began, there were state high-powered committees formed on the directions of the Supreme Court, which had given various guidelines for prisoners to be released to decongest prisons. Of that, one of the criteria also was to ensure that senior citizens could be considered, people who were susceptible to getting the virus could be considered for temporary relief. Based on that, Varavara Rao had filed for bail in March, and the bail application was rejected on the grounds that since he was charged with Unlawful Activities Prevention Act, which is a serious act against him, they said that he cannot be granted bail. Following that, in May, the 80-year-old poet fell unconscious in Taloja Central Jail, where he is lodged, and had to be rushed to the state-run JJ hospital. The family has recently said that because there was a bail hearing within a few days after that incident, he was given quick treatment and discharged from the hospital. After he was discharged, the court has rejected his second bail application as well, seeking relief similarly on the grounds that he was susceptible to the virus and on other medical conditions. More recently, on July 13th, Mr. Rao again fell ill and had to be taken to the hospital. Before that, his family had received a call from him in which he was incoherent. The family said that he was speaking about events which have taken place at least 50 years ago or 70 years ago and was talking about it as if it were happening now. His co-accused also spoke about how he was unable to do any work by himself and was depending on others for even basic chores. After the family made an appeal that he should be shifted to the hospital, given immediate medical treatment, he was shifted to the hospital eventually. But among the tests that were conducted on him, the COVID-19 test was also conducted, and this week he was found positive for the virus. And on Sunday, he was shifted to a private hospital, which is the Nanavati Hospital in Mumbai. And the family had approached the Bombay High Court seeking permission to see him, along with other reliefs, including an appeal against the special court rejecting his interim bail plea. The Bombay High Court on Monday has now sought responses from the National Investigation Agency as well as the Maharashtra government on whether the family members can be given permission to see him or visit him and see him from a reasonable distance since he has COVID and his condition remains critical.
And what kind of appeals have we heard, about his case from the opposition, from other activists, considering he is an old and, in many circles considered a revered figure?
So actually, his own lawyers have made a lot of appeals before the court as well, stating that so far, the charge sheet was filed in November last year and in 2018. And so far, they have not been able to substantially speak about what is the evidence against him to link him to the Elgar Parishad incident as well as to the violence that took place. When the Maha Vikas Aghadi came to power last year, they also spoke about how they would ideally want to relook at the case because there were activists which spoke about how the BJP had tried to name him and several other activists to shelter accused who were actually behind the Bhima Koregaon violence. Following that, there were also some 14 MPs, members of parliament, who had recently written to the Chief Minister, Uddhav Thackeray, stating that he should be given immediate hospitalization, he should be given immediate care. All of this, including, for instance, what the National Human Rights Commission has said, even if he's an under trial, medical care for somebody like him who is suffering from various illnesses, including now the doctors suspect he has dementia, which based on the preliminary tests that were carried out, and there will be further medication as well as tests conducted to confirm that. They're saying that he should be released at least on humanitarian and on medical grounds. So the appeals also say that since the lockdown is currently in place, no criminal trials are expected to resume immediately. So it will take a lot of time for the trial to start even in this case.
You were listening to Three Things by the Indian Express. Today's show, as always, was edited and mixed by our producer, Joshua Thomas. Before we go, here's another reminder to check out Indian Express's Explained page. You can log on to indianexpress.com/explain and find in-depth analysis by the right experts. It has everything you need to know to understand the news better and see the bigger picture. If you like this show, then you can subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcast@indianexpress.com.